Today we will speak about management of AF. So let's start. Management of AF includes heart rate lowering drugs, antiarrhythmic drugs, anticoagulant, and catheter ablation or surgical therapy. Heart rate lowering drugs includes beta blocker, calcium channel blocker, digoxin, and amiodarone. Beta blocker first metoprolol intravenous bolus 2.5 to 5 milligram over 2 minutes. Repeat every 5 minutes up to total 15 milligram as needed. Second is propranolol 1 milligram IV over 1 minute. Then 2-minute interval you can repeat up to 3 doses. Osmolol intravenous bolus 0.5 milligram per kilogram over 1 minute, followed by 50 microgram per kilogram per minute. If after 4 minutes response is still inadequate, increase rate of infusion to 100 microgram per kilogram per minute. If after 4 minutes is still inadequate, increase to 150 microgram per kilogram per minute. You can repeat another time up to maximum 200 microgram per kilogram per minute. Calcium channel blocker, verapamil, intravenous bolus of 5 to 10 milligram over 2 to 3 minutes. Can be repeated every 15 to 30 minutes as necessary and as tolerated by blood pressure. Once rate control is achieved with intravenous bolus, start maintenance infusion rate 5 milligram per hour. Diltiazem, intravenous bolus of 0.25 milligram per kilogram. Average adult dose is 20 milligram over 2 minutes. After 15 minutes, a second bolus dose of 0.35 milligram per kilogram, average 25 milligram over 2 minutes. If good response, continuous infusion at rate 5 to 15 milligram per hour is initiated. Oral dose of verapamil, 40 milligram 3 or 4 times per day. It can increase to maximum 360 milligram per day in divided dose. Diltiazem start as 30 milligram 4 times daily. Maximum dose 360 to 480 per day. Flecainide, under trade name Tambocor. It's sodium channel blocker. It's contraindicated in structural heart disease. It can be used pill in the pocket antiarrhythmic therapy. You can start with 200 milligram if body weight less than 70 kilogram once daily, or 300 milligram if body weight more than 70 kilogram once daily. Then maintenance 50 to 150 milligram twice daily. Dose if IV flecainide is 2 milligram per kilogram over 10 minutes. Propafenone, under the name Ritmonorm. It's a sodium channel blocker, not recommended in patients with structural heart disease. It can be used in pill-in-pocket therapy. Oral tablet can be given 450 milligram if body weight less than 70 kilogram, and 600 milligram if body weight more than 70 kilogram once every 24 hours. Maintenance dose is 225 up to 425 twice daily. Intravenous Propafenone can be given 2 milligram per kilogram over 10 to 20 minutes. Amiodarone, potassium channel blocker. It's safe in structural heart disease. Can be given oral or IV. IV start with 150 milligram over 10 minutes. Then infusion of 1 milligram per minute for 6 hours. Then infusion of 0.5 milligram per minute for 18 hours. Or oral loading dose 600 to 800 milligram per day undivided dose, followed by oral maintenance dose 100 or 200 milligram once daily. Vitamin K antagonist, warfarin, target INR 2 up to 3. Indication: Patient with valvular heart disease, like rheumatic mitral stenosis, that is severe. Mitral valve area is less than or equal 1.5 square centimeter, or patient with mechanical heart valve of any type, or patient with surgical or transcatheter bioprosthetic valve implanted within the past 3 to 6 months, or patient in which direct oral anticoagulant should be avoided due to drug interaction or due to chronic kidney disease with estimated glomerular filtration rate less than 30 milli per minute. Direct oral anticoagulant, like direct antithrombin inhibitor, dabigatran or Pradaxa, or factor 10 inhibitor like apixaban or rivaroxaban. Its effect is initiated within few hours, so no need for bridging with heparin. Catheter ablation, either cryoballoon ablation or laser balloon ablation. Also consider pacing and AV node ablation for symptomatic permanent AF or left ventricular dysfunction caused by high ventricular rate. Surgical techniques have been developed for control of refractory AF and the maintenance of sinus rhythm. In most patients, they are done as adjuvant therapy in patients undergoing other cardiac surgery, like mitral valve or coronary artery bypass surgery, like MACE or endocardial surgery.